At the center of the excitement around NAD precursors lies the promise of activating sirtuins, especially SIRT1 and SIRT3, key NAD dependent deacetylases linked to mitochondrial biogenesis, DNA repair, inflammation control, and longevity in model organisms. Since sirtuins consume NAD as a co-substrate, it seems logical that boosting NAD should enhance sirtuin activity. But does the choice of precursor, niacin versus NR or NMN, meaningfully influence the level of sirtuin activation, or does this popular narrative overstate differences based on selective or incomplete data? To answer that, one must first recognize that sirtuins don't sense how NAD was synthesized, they only require NAD levels to be high enough. Whether NAD was produced from niacin's price handler pathway or from NR/NMN's salvage pathway is irrelevant to the sirtuins themselves. They cannot see the precursor source. The key, therefore, is whether a precursor can restore or raise NAD. Pools in the tissues where sirtuins operate, especially metabolically active tissues like liver, muscle, and brain. Here, niacin's contribution is substantial. Niacin, once absorbed, enters the price handler pathway through NAPRT, creating NAD, then NAD, effectively raising NAD concentrations wherever NAPRT is expressed. The liver, in particular, is rich in NAPRT, allowing niacin to drive robust systemic NAD synthesis. In multiple rodent studies, high-dose niacin restored NAD levels, upregulated SIRT1 activity, improved mitochondrial function, and protected against diet-induced metabolic disease. In humans, niacin therapy has improved insulin sensitivity, reduced inflammation, and boosted mitochondrial markers, all consistent with sirtuin activation downstream of NAD replenishment. NR and NMN, meanwhile, feed the salvage pathway, which uses NEMPT, NRKs, and NATs to turn NR/NMN into NAD. Some animal studies have suggested more rapid or higher NAD increases with NR/NMN in certain tissues, but these results are often context-dependent, e.g., under conditions of acute NAD depletion or tissue-specific NEMPT upregulation. Moreover, many widely cited NR/NMN studies rely on models lacking functional price handler pathways, like certain cell lines, or artificially deleting NAPRT, exaggerating NR/NMN's apparent advantage over niacin. Even though in intact organisms with normal price handler activity, niacin can restore NAD effectively. Another source of confusion is timing. Some rodent experiments measure tissue NAD or sirtuin targets within hours of NR/NMN administration, capitalizing on their rapid absorption and short plasma half-lives. Niacin, especially in extended-release forms, increases NAD more gradually, potentially missing these narrow observation windows despite achieving comparable or even greater NAD levels over longer periods. These experimental designs risk biasing interpretations toward faster, but not necessarily more sustained NAD dynamics. Importantly, sirtuin activation depends on local NAD availability, but also on the balance of NAD consumption and regeneration. If NAD consuming enzymes like CD38 or PARPs are hyperactive, simply flooding cells with precursors may not sustainably raise NAD enough to support sirtuins. In that respect, any precursor, niacin NR/NMN, must overcome the same NAD sink, making claims of superior sirtuin activation by NR/NMN in humans premature without evidence they alter consumption pathways differently. Additionally, niacin's unique engagement of the GPR109A receptor, absent in NR/NMN, modulates inflammation through sirtuin-independent mechanisms, which may complement sirtuin effects by reducing NAD consumption driven by chronic inflammation. The final piece is real-world human data. No robust clinical trial has yet compared niacin to NR/NMN head-to-head for sirtuin target activation, e.g., deacetylation of P53 or PGC1A. However, given that niacin's cardiovascular and anti-inflammatory benefits already involve sirtuin-mediated pathways, it's implausible that niacin fails to activate sirtuins once it effectively raises NAD, especially since the magnitude of systemic NAD increases with niacin in humans often exceeds what NR/NMN have demonstrated. Thus, while NR and NMN may offer faster NAD rises in certain tissues under some conditions, claims that niacin cannot meaningfully activate sirtuins, or that NR/NMN are categorically superior, oversimplify complex NAD dynamics. They also overlook the redundancy of NAD metabolism. What matters most for sirtuin activity is whether NAD levels rise sufficiently in the right tissues, not which precursor was used. Recognizing this helps avoid misleading assumptions and restores niacin's legitimacy as a potent, evidence-backed NAD precursor capable of sustaining sirtuin activation, especially when dosing strategies balance tolerability with efficacy. The metabolic fates of niacin, NR, and NMN may differ, but their end goal, NAD, remains the same currency for sirtuin function.